would like to thank Varian Medical Systems for providing today's webinar. As AAMD's largest corporate partner, Varian provides educational content, funding, and other resources for many AAMD programs and activities each year. They are huge supporters of AAMD and of medical dosimetrists in general. They take great pride in helping dosimetrists improve their skills in order to provide the very best in patient care. We're very appreciative of their ongoing support. Now, without further ado, I am pleased to introduce the presenter for our National Medical Dosimetry Day webinar, Linda Meacham with Varian Medical Systems. Linda is Chair of Instructor Development as well as instructor for Varian Medical Systems in Las Vegas. She provides training for Eclipse and all new product releases. She also provides support and supplemental instruction for clinical product orientation. Linda, like many of us, started out as a radiologic technologist, then worked her way on to becoming a radiation therapist, then a medical dosimetrist, and now a great instructor to many people who especially are using Eclipse. So Linda is presenting today Advanced Breast Planning with Eclipse, Forward and Inverse Planning Techniques Overview. Linda?
Thank you very much for your kind words. Well, good morning, everyone, or good afternoon, wherever you may be. I'm so happy to be here with you today. I enjoy doing these webinars, and hopefully you'll get what you need out of these. Like I said, if you have a question, go ahead and type it in. I won't get to it until I'm done, but at least I can answer your questions while I have you online. I'm going to pull up my first patient. What we're going to do is we're going to start with hybrid breast planning. This is open tangents with IMRT tangents. I'm a huge fan of tangent fields. They work. All the tissue that needs to be irradiated is in the field. It's usually a simple setup. It minimizes lung dose and heart dose, and there's less integral dose all the way around. So I'm a huge fan of tangents. I think will keep working. So I have a couple of plans already done, but I'm going to start you off with my open tangent plan. All I have to do is drag it into the view. And there's a very easy way to get your PTV for the IMRT portion, and that's by calculating your dose and choosing a dose line to make our PTV. Now, I also have structures contoured that are the heart and the left lung, and those will help us when we want to just adjust our PTV just a little bit. So right now I have an open tangent plan here, and what you have to do first is decide how much dose you want to give to the tangents. I chose 50%, which is 108 centigrade for 28 fractions. 60-40, 65-35, that works pretty well. I just know that 50-50 really does not work that well. So what I'm going to do to start out with is I have in my dose prescription down here 108 for 28 fractions, and I'm going to come over here to the field weight, and it's just going to be 0.5 and 0.5. It adds up to 1 because I'm using the AAA algorithm, and then I'm just going to calculate this with equal weight. I can always adjust the weighting after I'm all done planning this, so I can just leave it right now at equal weighting. I come up to my calculate volume up here, and I let the system just calculate my open tangents with the dose that I have chosen. I also have a calc point in there because it is set up split beam that's 2 cm away from the ISO, but I'm still going to get a warning here telling me that the dose in the ISO center is too small, and that is correct, it is. So I'm going to close that. But if I come down to my dose prescription tab, you'll see that I put it in the reference point, 100% in the reference point. So right now, what I can do to get my PTV is choose a line that is going to cover the entire breast volume, like here, 95, and come over to the dose and right-click and say, convert your isodose level to structure, and put in 95% and say OK. And then what it will do is take that, convert it into a structure. It will be, they'll give you a structure properties box. Segment magenta is fine. I'm just going to say OK here. And it's hanging out over here underneath the structures. Now I can turn off all the rest of the dose for the moment, and you can see that now I've got a nice PTV. It's inside my lung. It's inside my heart a little bit. So I have to go to contouring. Let me save this, because you know Eclipse doesn't save for you automatically. Let me go to contouring. And that way I can just crop it out of the two to make it useful. I've done that already with the PTV, but I'll show you the steps. So I have dose 95%. I get my crop structure tool, and I can just crop my dose 95, remove parts extending inside my heart by like 3 millimeters and say OK. And then I can go back up here and right-click and tell it to, whoops, let me come up and get my tool up on the toolbar. Crop it again, and I'll crop that dose 95. Remove parts extending inside, this time my left lung. And again, just 3 millimeters, and say OK. The thing that's really important when you're doing IMRT planning, hybrid tangent IMRT planning, is you see how close this PTV gets to the body outline here? I'm just going to crop that away by 3 millimeters. If you don't do that, then your plan is going to get very, very hot. Eclipse will put dose exactly where you want it to put it, but it's going to get very hot at the edge there, and that's the thin part of the breast, and we don't really want that to happen. So if I go to my dose 95 again and go back up to my crop structure, then what I can do is crop that dose 95, remove parts extending outside, believe it or not, outside, and I'm going to say body by 3 millimeters, and you'll see it pull back from the edge of the contour. Just that little bit is all you have to do. And now we have a nice PTV. I've got exactly the same PTV right here that I did before in my other plans. So let me take you back to external beam planning. That's all you have to do to get a nice PTV there. And of course, if you have a tumor bed in there, you can make a CTV and ask for a little bit more dose in that as well. So I've already got my calculated plan. What I'm going to do now is just copy this plan, come back up here to these open tangents, right-click, and say Copy Plan, and I'm going to paste. I want to get all my fields in one plan. So this is my hybrid. And for the dose this time, I want the full dose. I want the 180 for 28 fractions, and say OK. Now with the hybrid pulled over, I'll take this medial tangent field. I will right-click and copy the field, and then I will right-click and paste the field, and I will call it medial IMRT. And I'll say OK. I'll do the same thing with the lateral tangent. I'll right-click and copy the field, and then I can right-click and paste the field, and I will call this one lateral IMRT. And say OK. All right. So I have my medial tangent, lateral tangent, and I can rearrange these so that when it pulls up at the machine, the therapist can just treat the medial tangent, then the medial IMRT, and then the lateral tangent and the lateral IMRT. It'll be a nice, quick treatment for the patient. Under the planning menu is where you would find your field order down here. And all I have to do is click on the one that I want to move up one. That's it. Say OK. Good to go. The reason I have this recalculate to update the dose is I have something called persistent dose on. So even though, let me put the isodose lines back on, even though I did something to invalidate the dose and the MUs are gone, I can still see my isodose lines, and that's kind of nice too. So once we have all of this and we have the full prescription in our box down here, I'm going to take this into the optimizer. I have the structures that I want. I'll come up to Planning, and I'll go to Optimize. Okay. Before I do anything else, I'm going to come down here into this bottom window. Down here, the medial tangent, that's my open tangent. I'm going to come in here and double-click on that little arrow and turn it to none. I don't want the optimizer to optimize on that beam. Same thing with the lateral tangent. I'll turn it to none. Okay, now the optimizer will not see those two fields. I'm going to come over here and fix my jaws because I don't want to lose any of my flash or breathing room for my patient. And I'm ready to go as far as the fields are concerned. I do need to put in objectives. I'm going to come up and get one from my template section. Templates are really nice to have, especially when it comes to objectives, because if you have a template for objectives, it's a lot of tedious work that you don't have to do. So all I did was go up and say load objectives from a template, and I'm going to come down and get the one that I created for us right here. Let me see. This one has a heart and a lung and my PTV doses. That's all I need to do. I'm going to say select. Okay. I have 2 uppers, 2 lowers, and on version 11, which is what I'm showing you this on, it's kind of nice to have 2 uppers and 2 lowers in IMRT and with Rapid Arc. My heart, I'm saying 5% can get 1,200. My left lung, 6% can get 1,800, and I shouldn't have any problem with that. All the rest of the structures, such as right lung and spinal cord and total lung, those are basically out of the field. I mean, right lung and spinal cord is. So I don't have to use the dose 95 because I made my own PTV from that. And what I can do that's very nice is use my open tangent plan as a base dose plan. So that's what I'm going to do. I'm going to come down here and say select, and then I'm going to go in to my LM over here and get my open tangents. You see it's been calculated. It says yes. If it has not been calculated, Eclipse will have it grayed out for you. You won't be able to bring it in as a base dose plan. And I'll say OK. And it's right here, my open tangents. So my smoothing is at 30 and 20. You know what smoothing does. It removes the drastic fluences so that it's more easily deliverable on the machine. And I have all of my objectives in here. I am not going to use the NTO. There is not enough normal tissue that I want to spare, quote unquote, because it's a tangent. We want to treat all that breast tissue, and there isn't really anything normal. The actual, what I want to say, the field edge to the chest wall itself is only 1.8 centimeters, so that's about 8% of the lung volume. I don't need to do that. I can use my constraints. The normal tissue really isn't an issue with this, so I am not going to use it. I'm just going to leave it alone. I can exclude structures to make this quicker if I wanted, holding my control key down and taking out a few that I know I'm not going to be using. I can do the bones as well and say OK. So that shortens this list up for me. I'll take this off for right now so I can speak to you for a moment. And that's about it. So let me see if I've got everything in there. All I have to do now is come up here. All of this is all together now. I have a target, so that means my Optimize button is ready to go. And I'm going to go ahead and click on my Optimize button. It creates those weighted point clouds to represent the structures to the computer. And it's always going to give you this because I have such a shortened field. I'm going to say OK. Whoops. Let me say OK here. What I'm going to do, the reason it failed, I'll show you in a moment. I'm going to apply what I've got. And apply means that all of this is being saved for me. And I'll say OK. In the calculation models, OK. Dose volume optimizer is there. All right. So let me pull over my hybrid again. Go back up to planning. Go back down to optimize. All right. I have all of my objectives in there. Oops, it turned my IMRTs to none. I have to go to Beamlit. I don't know why that happened. Okay. Oops. Turn everything to beamlet, and then I can turn them off again. Okay, so I want my medial tangent off, set to none. My lateral tangent, set to none. The other two are beamlets. This should be fine now. I'm going to apply. I have my open tangents up here. I have full prescription, so I'm going to say optimize. And I'm going to say OK. Okay. So now it's optimizing. I can take off whatever I don't want to see. I don't want to see the body. I don't want to see the CTV. I want to see my PTV. All right. And here's my Fluence. I can go through both of the fields and show my Fluence as it's optimizing. I really don't have anything to interact with as far as negotiating with the system to get, criticals down, because there's only 2 critical structures, and they're not getting that much dose. The dose that they are getting down here that's close to the prescription dose is maybe, a few voxels or 1% or 2%. So it's really doing good. That means I can turn these automate optimization buttons on. There's an automate intermediate dose. What that does is it looks at what I'm asking for in here. It looks at what it's giving me. It calculates the error between the 2 DVHs, and then it will adjust the leaf sequences to get me a better agreement. And it's a full AAA dose calc while it is calcing in the optimization window. And that should trigger pretty soon. Even if I didn't trigger it, I could have triggered it down here. If you expand this, all it's telling you, it looks just like a message box when you calculate your plan. So it's doing the intermediate dose calc, and then it's going to go back to automatic optimization process. And yes, I understand. And after it does that, once it's done optimizing, it's made its correction right here. The intermediate dose made its correction right here, and then once it flatlines out and it's done optimizing, it will throw it right into the leaf motion calculator. The leaf motion calculator is what's going to give me my IMRT setup for my Fluence. It's going to give me my MUs for my Fluence-based fields, and it's going to also make that file in the background that goes to the machine to tell the machine how to deliver our field. So it calculated the MUs. Okay. You can't see the MUs yet until you do the final dose calc. With version 10, you could see your optimal and actual Fluence after the leaf motion calculator. With version 11, you have to wait until you get done with the final dose calc before you can see your actual Fluence. Okay. And this will be done in just a few minutes. This is pretty quick. Okay. And I'm going to close it. Okay. Down here in the dose prescription, where it says no plan normalization, what I can do is come up here and say 100% at the reference point and say OK. All right. So right now it's at 108.2 hot. Now, as it is right now, let me pull this up and put the body on. These leaves are going to close down on the body. And I really don't want that to happen. So what I'm going to do is I'm going to first take a look at my Fluence. There's a little plus sign in front of the Fluence, and that shows my dynamic MLCs underneath. Go to the Fluence tab and right-click, and you want to say Edit Fluence. Okay? All right. Now in here, if you use the irregular surface compensator, if you're somebody who gets to use that in your clinic, you would be thinking to yourself right now, this green is awful low dose, this is an optimal dose. But remember, on the IMRT fields, I only asked for 35% of the prescription dose. So in this instance, this would be a correct Fluence to extend. Now there's 2 ways that you can extend your Fluence. I shouldn't really say extend your Fluence. In the Fluence editor, you can paint dose outside here, taking the values from inside here where it's green. If you click on your measure transmission factor and click around in the green. You'll see it updates in the transmission factor 0.104, 0.99, 0.103, 0.105. It's updating around here 0.109. You could, and as high as 115, you could select a brush and then just come in and paint your dose outside here, and that would be enough to get the leaves off of the body contour. My favorite tool to use for something like this is come over to the Fluence icon, right-click, and go to your Skin Flash tool. What the Skin Flash tool does is it takes this Fluence, this existing Fluence, and extends it beyond the body outline. What I like about it is you set a brush ceiling by measuring your transmission values towards the edge there. I got 0.104, 0.102, 0.103, 0.105, 0.102. So in this brush ceiling value, if I put in 0.103 and a cut range of 1 millimeter, what the system will do for me, instead of having to average out those values, is it will go in and it will sample the Fluence in here based on my brush. It won't go over this brush ceiling, but based on my brush, it will sample the existing Fluence and look at a cell 1 millimeter from beyond the diameter of the brush and extend the existing Fluence out into the periphery of the field. And when you do this, when you hold your left mouse down and do this, it turns gray. Okay, but then as soon as you lift up, you see that you've got that nice green Fluence, and you can paint inside this entire field. And if you don't like what you've done here, don't apply. Just cancel out and come back and try it again. But I'm going to apply this, and then I'm going to go to my lateral tangent. I'm going to do the same thing. I'm just going to take my little transmission tool, and I'm going to jump around in here looking at the transmission factors as they update. That's a little bit big. I'll say something. I'll keep this at about 0.104 this time. And grab my brush, come down here, and come up, painting Fluence. Got that nice green Fluence out there where I want it. Don't worry about this Fluence out here because our primary jaws are blocking that off. I'm going to say apply. I'm going to say OK. Now what I have to do is recalculate because I want to make sure that I don't have any leaves closing down on my body. It's only going to recalculate the two fields that I edited, which is my medial and lateral IMRT. I'm going to say OK. Alrighty. So it's kind of nice that it's not going to waste my time doing the other two fields, just the two that I edited. All right. Now I have my full hybrid plan. If I go to the MLC icon, and I'm going to show the animation, you'll see it's going to go from left to right, but it will not close down on the body. It will keep going past the body, which is exactly what we want so that we don't interrupt the flash. Same thing on the other one. Again, left to right. It is a sliding window technique if you have a varying machine. Monitor units are reasonable. As you can see, the IMRT fields are grayed out. If 109.3 is too hot, then you can either edit Fluence or you can also adjust the weighting. These can be adjusted right here. So either way, to get that down a little bit more, my hybrid that I did for you, I think is basically the same, 109.5. Yeah, it's basically the same with the same options. So it's really pretty easy to do one of these plans. It's nice because it's all contained in one plan. It's got one normalization point, and it's an easy way to break up the dose. And I'm a big fan of hybrid tangent planning. I hope this helps you with your hybrid planning. Now I'm going to minimize this. If you have any questions, go ahead and go ahead and type something in. I'm going to be bringing up my other one, which is, which is basically going to be a almost chest wall. I don't have a chest wall in here, but what I do have is something that's very, very small. You see, I don't have a lot of tissue. And I'm going to bring in my field and field. I'm going to uncheck this bolus here. This is a very, very small breasted chest. So what I want to do is a field and field, which is a forward type planning. It's a step and shoot method where, of course, we take our MLCs and cover up the hot dose that we have. With this field and field, I can put a bolus on here, and as long as the bolus is linked to both fields, whenever we create a subfield, it will be linked to the other fields. Now with field and field, as we all know, the gantry has to be the same, the collimator has to be the same, the couch has to be the same. The energy per field does not have to be the same. I can have 6s on my medial and 10s on my lateral, but all the energies from the subfields have to be the same as the parent field. But I can use different energies. Okay. The other thing that's nice, let me put my bolus on here for just a moment and bring this up. Do you see how this tangent field is coming at an angle? The nice thing about Eclipse is Eclipse will take that into account, and it can calculate the actual depth coming in from that angle. Let me show you what I mean. With my lateral tangent, I'm going to right-click and go down to the Properties, and I'm going to go into the Geometry tab. Okay. Oops, I got to link it first. Let me cancel that. Let me come over here to my lateral tangent, right-click, and I'm going to ask it to link to the bolus. I'm going to do the same thing on the medial, tell it to link to the bolus. It's a 1/2 cm bolus. And when I go to my Properties on my tangent field, you see my calculated is 92.6. Right down here, 92.6. But it's not exactly a 1/2 cm. It's more like, I would say, almost a cm, because it's coming at this angle. Eclipse calculates it correctly. It always knows what, from the angle, and it calculates the bolus with that angle in mind. It's not as big a difference on the lateral as it is on the medial. The lateral tends to be going through a little less bolus here, but it will give you the correct monitor units accordingly, because it does take into account the trajectory of the beam when it calculates the bolus distance. So it does see that for the calculation. Let me bring this down. So what I need to do is I need to come in here and calculate this plan. I'm going to go to my dose prescription. It's going 180 for 28. And I do have a calc point. I'm going to right-click in here to show you the calc point that we have. Here, I'm going to show the graticule. You see we've got our calc point a little over 2 cm away from the isocenter. And I'll click on the other field and right in line from there as well, a little over 2 cm. I don't have much tissue here. She's only got about 5 cm at the most tissue. So she's pretty good. It's as good as I can get for a chest wall, but the actual procedure will be the same. So I'll go ahead and calculate this. Take that off. Okay. And their open tangents equal weighting right now. They have to have an MLC on them now. If you don't have an open MLC, then you're going to have to use a calc point for the normalization. I mean, you do have to use a calc point for the normalization, but you cannot get the new field and field. I have here 100.7. That's not exactly correct. I'm going to go down to the dose prescription tab, come over to no plan normalization, and I'm going to calc for my calc point and say OK, and that's a little bit better. So now I have 113.5% hot. And what I'm going to do over here with my isodose lines is I'm going to right-click and go to isodose levels. And I'm going to bring this down. I'm going to turn everything off in 3D. except for the 110, but I will actually make that one 111 and say OK. This will be the first, and of course it's right over that sensitive medial spot, mid-plane spot. This will be the first line that I put a field in field on. So with my medial tangent highlighted, I'm going to right-click, and I'm going to go to New Field in Field. Okay. When I do that, what I have is I have all my MLCs. It gives me my waiting box. It activates a drawing tool for me. But what I wanted to do was take that off for a moment, and I'm going to use this Select MLC Leaves. For those of you who may come in here and put a block over the lung, I didn't do that on this one, but if you do, the way to maintain that integrity and not have to trace over it every time, and also maintain the integrity of where all the other closed leaves are, is by selecting only the leaves you want to move. If I have the Select MLC Leaf tool on and I click on this leaf, I'm going to hold my Shift key down and click on this leaf. Now I can get my drawing tool back, and I can come in and draw right around the back of this isodose line. And you see it's come out a little bit past the body because of the bolus. Come right up here. And now I can be as sloppy as I want getting around back to where I started, because only the leaves I highlighted are going to move. Only these leaves will move because they're the ones I highlighted to say to move. There we go. I'm going to click on Interactive Apply, and I'm going to come up here and say Calculate. And it's going to calculate that first subfield. And the reason I know it's a subfield is in the info window down in here, it says left medial tangent dot 0. I'm going to say close this. Now I get a red 0 here in an orange box. I just need to adjust my weighting, and the way I'll do that is just to pull on this little tab just a little bit and lift up, and I'm watching the dose shrink away, and I'm watching the monitor units. Okay, good. You should have at least 5 monitor units per subfield. And I'm going to close this, and I'm going to save it. And then I'm going to go to my next isodose line. So I'll go over here to the dose, right-click, go down to isodose levels, and this one I'll choose, say 109, and say OK. All right. This time I'll go to my lateral tangent, and I can right-click and say New Field in Field. And down here it now says left lateral tangent dot 0. Let me move this out of the way. And again, I'm going to take the drawing tool off. This stays sticky for me. I'm going to come up and highlight my first leaf that might move, hold my Shift key down and the last leaf, and now I can draw. So I have to get my drawing tool back again, and I will come from the outside jaw, go around to the back, go all the way around this isodose line. If you've got a nice steady hand, and then you can just hold your mouse down and draw. My hand's not so steady anymore. So let me come out here. And now again, I can be as sloppy as I want, getting back to my original. And I can click inside here so that I can move these leaves just one at a time. Move this over like that, click inside the aperture, hit Interactive Apply, calculate your field again. It's only going to calculate the new field. And I'm going to close this. Excellent. And I'm going to take my little slider bar here and move it just a little bit, lift up, watch the dose shrink away, only 3 monitor units, a little bit more than 4 monitor units, how about a little bit more? Not quite. There we go, 5 monitor units, I'm going to close it. Now I can come over here to my, let me see, I have a medial lateral, so back to the medial. You notice I keep going back to the parent field. And I'm going to choose another isodose line. I'll say isodose levels, and this time let's choose something like, you're not limit it to whole numbers. I can say like 107.5, say apply. Let me see if 108 is any better, and hit apply. Nope, maybe 107 will be better, and say apply. Yeah, I'm going to say OK. And then I can come back over to my medial tangent, and whoops, right click, say new field in field. Alrighty. I'm going to put on my interactive apply, and the first thing I'm going to do before I mess up is come over here to where my first subfield is and lock it. When I pull weight off, I only want to pull weight off that parent field. I don't want to pull it off my other subfield. Then I'll come up here, take that off. As far as the drawing tool, I've got these leaves selected, so I can come up and select the first one, hold the shift key down, get the last one. Then I can get my drawing tool, and I can draw behind this isodose line. This is doing good. One of the problems I used to have whenever we had chest walls or something like this was it was always really, really difficult to keep the hot dose down unless we did something like this. And now, of course, like I said, I can be sloppy. And then I can click inside here to set them and move one at a time and calculate my field again. Okay. Alrighty. And I'll close this. And again, probably I'm going to weight it to where it comes out to about the first one because that gave me 5 monitor units. But that's not always a golden rule. I want to do it until that line disappears. And let me go a little bit more. Awesome. I'm going to close it. I'm going to save it. I'm down to 106.6 hot. We'll go one more. So that was my left medial. I'll do another left lateral then. And we come up to the isodose levels. Let's try something like 105.5. See what that gives me. Yeah, that's pretty awesome. Yeah, I think I'll try that. I'll say OK. Now in the 10, we get a new field in field. Okay. All right. And again, the first thing I do is lock that first subfield. I've caught myself before not doing that, and then I had to go back and change things. Take this off. My leaves are selected, so I'll take that, hold my shift key down, highlight this one, get my drawing tool, come back around now, and draw behind my isodose line here. And again, be as sloppy as I want coming back. Okay? Click inside here to set them all so I can just move one leaf at a time. And I can pull this one in a little bit, that one in a little bit, that one in a little bit. Okay? And I'm going to calculate. And I'll close this, okay? And again, I'm going to pull weight off that parent field. And a little bit more. The reason I don't want to get too aggressive is if I had something like 10 monitor units, that would be too big of a jump down in dose. And then I probably would be having a lot of tissue pulled away from the chest wall. I mean, a lot of dose pulled away from the chest wall. So now that I have all of this done, I have all these subfields. Inside here, what I can do is, instead of having that MLC highlighted, I'll highlight on a field. And I can right-click and say, Show All MLC Apertures in Beam's Eye View. So you can check these. In other words, before you merge your fields. Up here, that's the first one I drew on the lateral. That's the second one I drew on the lateral. We try not to do retroactive. In other words, try not to do your, if you were going to do a third one that went smaller back here. Not that Eclipse can't handle it. It can, and Eclipse doesn't care. The machine might. and I can't say for certain whether or not it will. I'm just saying it might not load at the machine. Eclipse doesn't care. Eclipse can go back and forth with those MLCs, and it really doesn't care. I'm going to go to my medial and, again, show all MLC apertures. So you can check it. This one's farther in than this one, not farther out. So that looks good. To merge subfields, extremely easy. This takes this field, it leaves it intact, it merges it into two fields again, and let me come up to my planning and go down and say merge subfields. Now what's going to do this? My leaf motion calculator is going to do this. It's telling me that it's going to merge them all. I don't see any outliers, and I'll say OK. And I can round to machine precision. I don't have to because Eclipse will for me. I'm just going to say OK. All right. There we go. Excellent. So 105.1 is my hot. I'm liking that. Only 97 monitor units. I'm liking that. And as you can see here now, I have a dynamic MLC. The bolus is intact still on all of them. Now come up here. I want to show your attention up top. I did some. I think I got the exact same thing down here. You see this original field and field that we were using. The one underneath it is the merged one. This one has a line through it. This line through it means it's been rejected. It's not retired. It's rejected. If I right-click on that and go down to plan approval, you see where it says rejected. A rejected plan is just that. It allows editing, but it does not allow this plan to be shown at the machine. So the therapist cannot pull up the wrong plan, in other words. But if for some reason you look at your merged plan, you say, oh, I don't like this, I want to go back in, it pulled too far away from the chest wall, I want to go back in and do some adjusting, you have that original plan to do it on. You don't have to copy and paste and make another plan, because basically Eclipse did that for us when it gave us our merged fields. And it's a really nice feature, because it does allow editing. Rejected plans are just that. If a doctor looked at it and said, I don't like it, he can reject it. Well, that allows you to go in and edit, you know, and not have all these fields hanging out over on the scope window. So you guys have been awesome. I'm open to any kind of questions that you may have. If there's any kind of something you want me to show you or do, please let me know. I don't see any other questions that are up here.
There were lots of questions once she went through them all.
Oh, she did?
All right, well, while we're hunting down the questions, thank you for attending the webinar. Make sure you do go and take the post-webinar exam to get credit. Again, the link is off the home page in the National Medical Dosimetry Day webinar page. All the quizzes are there. Without that, you cannot receive credit. The rest of you want to stay around for the Q&A, we'll find those and start answering them.